Here's how to fix your phone calls so that you can increase production at your practice, and also to stop making some big mistakes on the phone which crash your patient show rate. This is all about the questions we're asking on the phone. So if you're not asking questions on your new patient phone call right now, if you don't have a script, I'm giving you the sauce right here, so pay attention. So first of all, we need to have strong openers, things to get the ball rolling with the questions. Why do we need openers? You need opener questions because sometimes a patient will run away with the call, or you end up on some long tangent that doesn't help, and it's going to ruin your phone call, and that patient won't book and they won't show up. So if you have strong openers, then the patient will book. It's a big mistake that a lot of practitioners are making. Here's how to solve it. So there are 3 questions you can ask, starting from the most basic to my favorite question. So number 1 is, what can I help you with today? This one might seem obvious, but if you're not intentional about asking the patient this question, what ends up happening is they go on a long rambling tangent about, oh, I was at this other practice, or what about this, or my insurance that. No. Hey, how are you doing? My name is Joshua. How can I help you today? Or what can I help you with today? You need to be asking this question to get the ball rolling. Remember, this is an opener. It's not going to have your patient in a pool of tears telling you about how bad their situation is. It's to get the ball rolling. A slightly better question is, hey, what's going on with your teeth? So what is going on with your teeth? We want to start directing the patient's focus to their mouth and to their concerns, things that they can describe. It's going to lead us into the situation questions, but this is a really good one to ask. So what is going on with your teeth? The third question here, and this is my favorite. It's my favorite because it gets almost to the emotion, right? It almost allows us to skip the situation questions, but we still need to hit it. It's, what makes you think you need XYZ treatment? This is great for when your patient calls in and says, do you guys do crowns? Do you do implants? Do you do Invisalign? Whatever the patient is asking for, this is the response, right? You tell the patient, yes, we do that. What makes you think you need an implant? This is a 10 out of 10 question. The reason is, it cuts to the heart of the issue, why the patient is asking about a specific treatment. So instead of them going, well, how long has your doctor been doing this? Or what materials do you use? Or how much is it? All these other questions, we obliterate it with, what makes you think you need implants or Invisalign? Whatever the patient asks about. This will allow you to transition to your situation questions. So the situation questions, these are all about what's actually objectively going on in your patient's mouth, right? We need to ask these questions because without them, we're never going to get to the emotional questions. By the way, one of the biggest mistakes that most of you might be making is you're not getting to the emotion in the phone call. What this causes is patients to not commit to their appointment. So if you want higher show rates, you've got to get to the emotion. Situation questions lead us to the emotion. So they're the how many. If the patient says, I think I need a filling, I have cavities, you want to ask how many. If the patient says, I need implants because, right, they just answer this question, I need implants because I'm missing teeth. How many teeth are you missing? Right, we want to ask how many. This is to get the patient thinking about their situation. Which, by the way, most of your patients, they're not even thinking. They don't think about their situation. So just asking these questions, it builds authority, it builds trust, and it builds rapport. So by the way, if you're not taking notes, if you don't have a script, I highly encourage you, write these down, put them on a sheet of paper so that you're always asking patients on the phone. Next question, where? Where in your mouth? Is it on the top, the bottom, the left, the right? We want to find out. If the patient says, I'm missing teeth, where are those missing teeth? Obviously not in the trash somewhere. But where in your mouth are you missing teeth? If they say, I need a crown, where is it? If they say, I have a toothache, where is it? We want to locate specifically. The way you know you've done this right is if by the time you're done with the call, you can draw out exactly what the patient has in their mouth. Like you could draw out all the teeth. If you can't do that, you're not asking good situation questions. Now, my favorite situation question, because it's the bridge into the emotion, is how long? How long have you been missing teeth? How long have you been in pain? How long has it been since your last cleaning? Asking this question will start to get into what the patient is experiencing in his or her life. We've got to get into the how long because it tees us up for all of this. Now, there's two really good follow-ups to the how long question, and that's the why now and is it getting worse? Now, there's a big mistake that a lot of people make with the why now. Instead of asking why now, they'll ask some version of what stopped you from getting treatment in the past? That's a bad question. It's going to get you objections and it's going to get you excuses. None of that will help you on your phone call. So what you want to do is focus on now. Why are you doing this now? If you focus on the now, you could use the word today, but now works best. Why are you doing something about this now? Will get the patient into emotion. They'll move over to this section without you having to do anything. So it'll sound something like the patient tells you, hey, I'm missing teeth. How many are you missing? I'm missing 3 teeth. How long have you been missing these teeth? I've been missing them for 1 year. Some of your patients are missing them for longer. I've been missing them for 1 year. Okay, so it's been 1 year. Why are you doing something about this now? Why now? Notice how that question is going to lead into the motivating reasons. You see, your patient is never buying teeth. They're never buying treatment. They're buying a change in lifestyle. What was my life like today versus what will it be like tomorrow? This why now, it gets you into that thinking. Is it getting worse? This is a really good question for motivating your patients. A lot of them lack motivation. That's why we're asking how long. Oh, it's been 2 years, 3 years, 4 years. Some of you have heard 5 years or more where the patient's missing teeth, right? Is it getting worse? This is a great question to motivate your patients. Now notice, you can't just open the call and go straight to the emotion questions. We build, and then we pivot to the emotion. Now this is the most important part of the call. If you do this right, your patients will show up and they'll be ready to get treatment. They'll be begging you for a treatment recommendation. If you don't hit the emotion on the phone call, they're going to call another practice, they're going to skip their appointment, and if they do come in, they'll be less motivated. So you really, really want to get this. The easiest emotion question is, are you in pain? Right? Are you in pain? This is a really easy one to ask. It surprises me that more offices don't ask this question. It's one of my favorite questions because you can follow up with scale 1 to 10, how bad is the pain? Now this gets the patient, again, back into their world. What are they experiencing? Oh, I'm in so much pain. This also gives you a chance to empathize. So if they say, I'm a 7 out of 10, you say, oh man, that sucks. Well, let's get you out of pain. If they say, I'm a 2 out of 10, gee, I wish you didn't have to go through that. I'm so glad you called, we can help you. Right? It gives us a chance to relate to the patient. So always be asking, are you in pain? Scale of 1 to 10. Now, if the patient's calling for cleaning, maybe you don't ask this question, but 9 times out of 10, you want to ask, are you in pain? Taking it up a notch, we've got the next question, do other people notice? So this is for a lot of cosmetic things. If the patient's asking about an orthodontic solution, or they're asking about implants, anything that would visually stand out. Remember, we had to ask exactly what's going on in their mouth. When you ask these questions, you'll know if this one is relevant. So, do other people notice your teeth? Do other people notice the situation? What this does is it gets them starting to think about the social impact of them not taking care of their teeth. And when they start to think about that, this increases their urgency to do something. Oh, this is making my life bad. So I need to do something to solve this problem. Another question very related, does this affect your confidence? Right? Does this situation affect your confidence? If the patient says, I'm missing a bunch of teeth, they're like, oh yeah, I'm missing my teeth right up in the front. Does this affect your confidence? Great question. Patient's probably not going to say, oh yeah, I have low self-esteem, but they'll say something like, yeah, I mean, I'm not completely comfortable with it. Again, remembering, we can't just ask this question from the beginning. We need to build up. If the patient calls in and says, I'm looking for implants, and you go, does missing teeth affect your confidence? That phone call won't go well. You need to stack, right? So we start with the openers, we go to the situation, then we move to emotion. The last one here is, have you stopped eating your favorite foods? Notice how all these questions here in emotion are patient lifestyles, right? This is affecting what the patient does on a day-to-day. Have you stopped eating your favorite foods is a great question, because if the patient has, they're missing out on one of their favorite parts of life, and you can help them fix it. So this stacks a ton of urgency, it stacks a ton of upside for the patient showing up to their appointment and moving forward with treatment. So if you do not have a script and you're not asking these questions, take one or two of these questions, write them down, and ask them on every single phone call. Ideally, you would take this entire process and implement it in your office today. But if you don't have time for that, do something small, move the ball forward. The closer you get the patient to the emotion, the higher your show rates and the better your case acceptance.